So what MDLIVE is looking to solve is really, it's not around just the individual itself. It's around how do you scale primary care to be able to take care of the masses, to be able to broaden a panel in which a typical primary care practitioner may see anywhere from 1,500 to 2,000 patients in their panel. But how do you contribute that to a large population and do the majority of the care virtually, which would free up access for other types of more complex patients within inside the healthcare system today. So MDLIVE is a unique opportunity to look at really the cost and the convenience equation, to where the majority of us know today that the largest portion of costs within our healthcare system consists of the very sick of the sick patients, and they take up the majority of the cost. But you also have those chronic patients kind of in that mid-tier who take up a substantial amount of the cost as well. But then there's a large population in America, and those probably are mainly the people who don't have primary care practitioners, who rarely go to the doctors, who rarely take out any of the costs within the healthcare institution. They're the majority of the healthy consumers that we have. But we feel that about 70% of care can be shifted to online, which would, as you can see here on the triangle, which would open up access into the majority of the institutions and organizations around the country to be able to take care of the sick patients and to be able to focus on those patients and have the time that they deserve. I don't think you'll ever hear anyone say that 100% of care can be shifted to online. It's just looking at those different levers and those types of patients that we solve today, and how do we shift some of their care online. And as you can see here from this graph, about 65 to 70% of the average consumer, we feel that their care can be shifted online. When you look at the cost equation again, comparing that to panel size, you see the opportunity to appropriately load balance within your healthcare ecosystem. If you look on the right, you see a complexologist. So if I go through the graph, they have a very high cost per visit, but they have a very low panel size because they're taking care of those very high, complex, and sick patients. Then you have your PCPs in the middle who have a moderate panel size and a moderate cost per visit, but still they're not really operating at the top of their license. And then to the far left on the screen, you see what we consider to be a virtualist. So we believe that there's going to be a rise of the virtualist. There's an inflection point that's happened within the past year to where the payers, the consumers, the provider market, and regulatory reimbursement have come together to really announce the rise of the virtualist. Like you saw within the mid-90s with the hospitalist movement, you're going to see that over the next 2 to 5 years, where more and more people are looking to offer care online, where medical schools and curriculums out there are training individuals to be a virtualist provider. And you could see from the graph here, something that we're constantly looking at, cost per visit. You can really increase your panel size, maybe 2 or 3x your panel size from doing a virtualist model, as well as lower your cost per visit. So that's what we're trying to really solve here, is how do we bring access to the masses to reduce costs and to allow organizations and healthcare institutions to focus on the patients that they need to focus on in their brick and mortar setting in the most efficient and effective manner. So when people ask what is primary care, what is virtual primary care today, it's really made up of your three, I would consider your three predominant pillars, and that's your preventive care, your chronic care, and your urgent care. But how do you wrap that really around the related specialties with digital therapies as well? Because in any primary care setting today, the value of having behavioral health access readily available. The value of having dermatology access readily available. With everything that's going on in America today and all the digital therapeutics and apps out there, being able to track your own weight or step on a wireless scale, but having the interoperability and the connectivity with those individual apps or devices is really what brings the full picture together when you're looking at how do you care for an individual virtually. You really need to wrap in all these components of preventive, urgent, chronic, as well as behavioral health and digital therapeutics into one type of offering and setting to be able to care for those individuals. When we at MDLIVE look at what we like to frame up as a year in the life of a virtual primary care patient, I'm going to briefly walk you through this slide here. And if I was able to share my screen, this would build out from left to right. But I'm going to start on the far left-hand side of this screen and work all the way to the right. So a day in the life of a virtual primary care patient would look like maybe the patient receives some pre-visit HRA information in a pre-visit lab, some lab information to get their labs done. So they fill out the HRA, and maybe that organization sends home a home digital exam kit. If you're familiar with the different device companies out there today that have, personable, consumer-friendly digital exam kits, maybe the provider or the organization sends that home with the patient. So the patient in this case fills out their HRA, they go get their labs done in a brick and mortar setting. Maybe it's at a lab that's part of a health system, or maybe it's Quest or LabCorp. But all that information is funneled into your virtual primary care team. And you as an individual can pick who your virtual primary care provider is. And as you see on the screen on your left, maybe late January, this patient sets up their virtual primary care annual exam, an annual wellness visit with this provider. And they actually have the visit virtually because that provider has all the information that he or she needs to know about the patient at their fingertips. On the very bottom of the screen, you're going to see a little chat bot. Her name is Sophie, and she's our artificial intelligent chatbot today. That does random check-ins for patients or scheduled check-ins for patients, as well as assist patients through a type of an adaptive interview and triage. So her name is Sophie, and we're having Sophie proactively reach out to these patients every month, making sure that they enter their information into the system. Have they had any trouble with their health over the last 3 to 4 weeks? And Sophie is an AI chatbot where she's able to send alerts and notifications to providers if and when something irregular happens with that patient. So Sophie continues to check in February and March and April. And that PCP provider has a scheduled visit with their patient to talk about maybe some hypertension and blood pressure. She noticed with her original appointment in January that she did have some high blood pressure and hypertension and anxiety in the past. So they scheduled a visit here within April to talk about that. So you have that, again, that virtual visit with your main primary care practitioner done virtually. And Sophie continues to check in. So May and June, she checks in, but there's an alert that comes about in June saying that there is some high blood pressure. So maybe that was from a remote monitor that connected into Sophie and connected into our system, which alerted that, or it could have been self-entered by the patient. But what happened as soon as that alert triggered, Sophie automatically popped up a member of the primary care team. So maybe that patient's designated PCP wasn't available, but as a part of the broader virtual primary care team, one of our MDs was available. She was able to intervene, have a consultation with the patient, and she recommended that this patient maybe needed to go to a brick and mortar cardiologist and maybe have some orders or some services done within a brick and mortar setting. So again, Sophie continues to reach out. July, in August, Sophie reaches out again and notices that the patient has had some high anxiety. So Sophie connects the patient into their virtual primary care provider, and that primary care provider, because behavioral health is a wrapper contained within virtual primary care, schedules an appointment for that patient to speak to a therapist. Again, this is done virtually. So Sophie continues to check out, and in the early check-in on that patient, and in the early fall, that patient, like the majority of Americans out there, had a bad flu season, and that patient got the flu. So they needed to have an urgent care visit. Again, it's with the virtual care team, maybe not necessarily the virtual care provider, the PCP for that patient, but a member of our MDs around the country took that visit and was able to prescribe the appropriate plan and any medications for the patient. So again, that patient is staying within the ecosystem of the virtual primary care component, and they're leveraging a virtual first mindset. So if you look at the bottom, you see really all those Sophie reach outs. And that's really the key component of connecting the patient into their healthcare providers using technology and leveraging the interoperability with connecting to various devices. That middle row there that you see from the annual well visit to the anxiety visit to the flu visit, that's really all your interactions with your care team that are done virtually. And then that top level right there is really the items that you still have to go to a brick and mortar setting to see. And did you lose my presentation by chance? I don't see it. Hello?
Yes.
Okay.
Okay.
I don't know why that just left. Okay, so that was the day in the life of a virtual primary care patient. And you saw there the 3 layers, really the remote patient monitoring. The middle layer was the interaction with the providers virtually. And the top layer was, again, what we talked about in the beginning, individuals still having to see some type of brick and mortar care with their patients and providers. So what are the keys of virtual primary care? Really, it's around relationships, which we know today can still be established virtually. You would be responsible, the patients would be responsible for selecting their virtual primary care provider, as well as being part of a care team. We know that it's extremely important to have interoperability and the ability to receive results, to review those, as well as to order out. So being able to still have a functioning EHR and interoperate with the multiple EHRs around the industry today is vitally important. I talked about that remote patient monitoring, and that remote patient monitoring is really the key component for individuals to be able to connect into their care team and to be able to have those digital devices send alerts and monitor the patient while they're not currently interacting with their primary care provider. The other one is referrals. So for most organizations and healthcare institutions around the country, you know how important it is to refer back into your network and to be able to ensure that you keep those patients inside your healthcare continuum. So being able to refer if and when necessary is vitally important. We talked a little bit about those digital RX apps or digital therapeutics, but being able to connect the patient full circle into managing his or her chronic conditions or any type of issues that they're having with their health is vitally important. And lastly, it's really the wellness screening. How do you, as a patient and a consumer, still interact with your primary care or clinician virtually to ensure that you're receiving the most proper screening and healthcare service that you can that can be done from a virtual standpoint. Some organizations around the country, if they haven't been looking at standing up a virtual primary care practice, some institutions that have a health plan have a narrow focus to where they have members where they can go from a plan design and stand up a virtual primary care practice and designate PCPs for those individuals to where it's a plan design for a virtual first option. Other organizations around the country may only want to leverage a virtual primary care service to start. So instead of setting up maybe an entire practice focused on a subsection of their patients or population, they want to start offering a virtual service as one of the first components out of the gate. Maybe they want to do annual well visits for individuals within their current patient population that have a specific demographic. So they could segment this population to do nothing but annual well visits online. Maybe it's follow up with a specific chronic condition, hypertension, diabetes, asthma. Maybe there's a specific need within your healthcare system where you want to target these patients to have a routine follow-up visit from a primary care service perspective, but it's specifically related to a chronic condition. Or maybe it's about medication refills. So I would say the most organizations that we're talking about virtual primary care today, it's kind of that old concept where you crawl before you walk and walk before you run. If you haven't really put in the time to think through the virtual primary care concepts and rolling out a national practice for your patients, it's how do you leverage some of these virtual for services to get going while you continue to plan and strategize as an organization around the broader primary care service line. I was going to take you through quickly just an option of, this is Sarah, and she is a member of the Blue Star healthcare system, and she logs into her patient portal and she sees some options here on what she could do virtually. Of course, she could go and see a doctor now from an urgent care perspective, or maybe she needs to have a behavioral health visit or a psychiatry, or there's a dermatology visit. There's all different use cases, but she wants to focus in on her annual well visit. Again, that was one of the examples that we talked about from a virtual primary care perspective. So she would go in, and again, she has the option of updating anything in her health profile, locating her pharmacy, but she clicks on the virtual wellness visit to go ahead and get that started. And what it does for Sarah is it runs her through really her health risk assessment. So she will go through a series of questions, again, where she's updating the system about her current health status, medication she's on, as well as some key vital signs. So all this information is populating the documentation for the provider to actually run over before they have their annual well visit. Lastly, if she's part of a health system, she's able to select a lab that's near her. Maybe she goes to the Blue Star healthcare system lab facility to get her lab draws done, or she actually selects a Quest or LabCorp. But again, she's going into the organization to get some of these labs done. But all this information is sent to the PCP so they can have a well-functioning annual well visit. And one of the last components for Sarah is she gets to choose her primary care practitioner. So who does she want to see from a virtual primary care perspective? That's going to be mainly her clinician that she's going to look to for care virtually for the foreseeable future. So those were just a quick few slides over the concept of virtual primary care and how an individual patient would go about scheduling this for a virtual primary care annual wellness visit. To talk through briefly a few of the values and the benefits, we talk about the consumer and the consumer wanting to be at the forefront of their own healthcare today and being able to leverage technology and being able to leverage providers virtually to bend that cost curve in the healthcare environment. It's really around the relationships and what you're able to establish virtually. People would be extremely surprised with the level and the comfort of the relationship that they have with their providers once they get to know them and they see them on a virtual visit, and they're able to interact with them regularly for their healthcare conditions. I think the remote patient monitoring and the results reviewing and being able to order and being able to connect to various devices and connect to chatbots like Sophie, so you feel like as a consumer, you're not alone in this endeavor. Even though you're doing virtual care, you're interconnected into the entire system. So they feel confident and they feel confident knowing that their healthcare is being looked at and triaged appropriately from the individuals that are surrounding them for the care teams. And then lastly, for healthcare systems and organizations, they want to ensure the referral management and the wellness screenings are done appropriately and effectively, again, based upon Stark laws and all regulations. But most organizations today want to instill that level of comfort and convenience for their patients to decrease leakage and to increase access within their organization. And what I would say is virtual primary care is a relatively new concept in the last year. Telehealth and virtual care has been around for many years within the healthcare ecosystem, but just a few organizations are moving forward light speed right now on virtual primary care. But we feel that it's an opportunity for most organizations to continue to offer the high quality healthcare they want at low cost and convenient mechanisms for patients and consumers around there. So hopefully you got a few nuggets of information out of the few slides that I presented. And like I talked about before, this is a hot topic within the healthcare technology ecosystem from a health plan perspective, from a health system perspective, and really from a consumer perspective. They want healthcare on their own terms, and this is a way for all of us to offer that. So Milton, I'll turn it over to you. Those were a few slides that I had, and see if there's any questions from the audience or questions from VSee. But again, thanks for taking some time to allow us to run through this today.
Hey, Michael, thank you so much that was an amazing presentation. And also, by the way, both Michael and also for the audience member, I apologize. We had some technical glitches in the beginning that got us really rough start, but Michael's a star, so he more than make it up.
No, that was great. It was good.
Yeah, Michael, one thing I was just curious, you have a long career, not, from Cerner before MDLIVE and stuff. Like, how did you got involved in the whole healthcare industry?
Well, I mean, coming out of school, business school, I grew up in the Midwest, and healthcare technology was prominent in the areas that I interacted in college. And I had grown up in Kansas City, so knew a lot about the Cerner and the large healthcare company there. And I always wanted to be a part of something disruptive. And I thought the intersection of technology and healthcare was something that intrigued me from, my college days and my business school days. And I always thought that there was a field and an industry that I wanted to be in. It revolves around technology and it revolves around healthcare, two vitally, important pieces to this overall, environment that we have today. And I've been in it ever since. It's been a fantastic opportunity for me.
Awesome. Okay, thank you. One thing I think what you're doing is really exciting, this whole virtual, because I know one of the complaints that these were historically just were virtual urgent care, right? You see a different physician each time. You don't get to build that relationship. So now you actually get to build that relationship, which I think is like just really awesome in there. And if it's not confidential, do you have a projection? For example, if you fast forward to, let's say, 2 or 3 or 4 years, like what percentage of your service do you think will be like through the virtual primary care versus like a traditional urgent care?
Well, yeah, I mean, so behavioral health is big as well right now. I mean, that's one of the fastest growing service lines that we have besides medical and urgent care and dermatology. But you are right. I mean, virtual primary care has taken off. So like I talked about, we have multiple large national health plans that are looking at rolling this out. A few, you could just Google, have put out press releases over the last few months and have rolled it out to their national members. We have a few health systems that are on board, getting ready to roll this out. I think, honestly, Milton, it's going to continue to increase. I'd hate to put a number on it, but this is the wave of the future. And if we want to fix healthcare, it revolves around, lowering cost and providing better access to care. And we feel like this is an unbelievable opportunity to do that.
Yeah, that makes a lot. It just makes like so much sense in there. And also, I think it's really impressive how comprehensive the program you created. Yeah.
Yes.
One question we have from the audience member, Peter, is asking, so the service you're providing, is this a subscription-based business or does MDLIVE bill insurance for this? I guess
Good
for me,
question. Yes, we do. Yeah, so right now for a lot of the health systems, it's probably going to be a subscription-based service. But yes, we do bill insurance. So absolutely, like I said, we work with national payers all across the country where they reimburse MDLIVE for telehealth visits. And a lot of those same health plans today are working with MDLIVE on the plan designs to be able to offer this to their members. And yes, of course, reimburse for the services. So absolutely. I think it's going to be an evolution because of how new it is. But yes, we do have insurance and, we do have payers all across the country that reimburse MDLIVE. And a lot of our health systems right now are looking to start this from more of a subscription type service though.
That makes a lot of sense in there. So another question from Peter, he's asking, so do you plan to offer these sort of specialty services? I guess, how do you do like a virtual handoff from, let's say, seeing one of your virtual primary care to, let's say, brick and mortar specialists?
Yeah, so that's part of the referral and transition process today. The services we offer right now are really focused around the chronic management, the medication refills, annual wellness visits, behavioral health, dermatology. So those are types of the specialties. But if they need to be referred, yes, that's where we're working with our health plans, as well as our health systems to understand who's an in-network referral, if you need to go see an ENT or a urologist or an endocrinologist, giving the patient the option to go in-network and knowing having MDLIVE know what insurance that patient is on is very key as well, which we do know that. On the health system side, there's some rules and regulations around patient steerage. So we're always cognizant of that and making sure that we have a very conservative approach. But yes, from a health system perspective, when they own the patient record and they want to refer within their system, that should be an option for those patients that we're going to move forward with.
Got it. That makes sense. So we have another question from the audience. So how about in terms, I guess, oral healthcare? Like is there something on your plans?
Yeah, we haven't. It is on the roadmap. It is something, again, with this being so new, virtual primary care, we have started to think through kind of the oral and the whether it's orthodontist, dentistry, whatever it may be for those patients. How do you incorporate that into, again, the virtual care mindset? We started off what I talked about. One of the pillars were preventive, chronic, urgent, and then the behavioral health and digital therapeutics wrapper. But oral is a fantastic opportunity. It's something that we're continuing to work on. We haven't quite nailed that yet and put that into the plans, but it is on the roadmap.
Got it.
As well as I see ophthalmology. Yeah, I see ophthalmology, oral. I see all those questions coming up. We'll get there, I promise. But right now, we can only do so much to start. And, that's where our clients really asked us to, before rolling this out, we pull a lot of our strategic clients together and talk about our services and our roadmap, and they kind of help shape with MDLIVE where we focus. So we will get there, but for right now, we're trying to roll this out nationally at scale, and we will get to the oral and the ophthalmology.
That makes sense. And for example, right now, like for Teladoc, they had a huge acquisition with InTouch. They seem to be like just build a massive infrastructure. Do you feel like how will MDLIVE versus the Teladoc, how will you guys compete, I guess?
Oh, yes. I love competition. I think competition fuels innovation. So I love it. Yes, they did have an acquisition. So MDLIVE is more, we've grown organically over time and developed proprietary software from the ground up, really. So we haven't had a enormous acquisition or merger strategy. We've done some things for, inpatient acute settings. And that's where I feel like the company you mentioned with their recent acquisition went after more of the acute side, high acuity, telestroke, and neonatology, which is a very good company as well. We've done a lot with partnerships there with other organizations around the country to be able to offer that type of technology. But from a competitive standpoint, I love it. I think it's great. And, MDLIVE is winning business all around the country with health systems and health plans. So we're providing a great service and a value to our clients and our customers. And I think the market sees that.
Awesome. So Michael, we tend to have a huge audience of physicians who tune into this webinar. I get a question. So for example, if a physician likes to work for you under this virtual primary care model, how does the physician get paid?
Very good question. So, they're paid upon visits, and there's different models that MDLIVE has, and depends on how many visits they do, how much time they schedule from us per week or per month. So we have a few different models. Like I said, we have around 1,400 providers. They're all board certified MDs that work for MDLIVE, and they get the option to choose if they want to be a part of virtual primary care services or not. So do they want to be a part of the care team that takes care of these patients and does annual well visits, chronic follow-ups, medication refills? So it's their choice, and they get extra incentives and higher dollar per visit costs because a few of these visits are longer than your traditional, sniffles, cold, or flu. So we do compensate them for that, and it's part of like their overall plan. MDLIVE does have full-time FTEs, that see patients that work for MDLIVE. And then we have, what we call provider networks and physicians that give us time based upon the various components that they see.
So if let's say I'm a brick and mortar physician, let's say I work for the MDLIVE virtual primary care, if the patient needs something that requires physical care, could MDLIVE then transfer me to so I get additional business? Or?
Yes. Well, it depends on, again, just around those legalities. So the technology could do anything. Yes. You have the ability to refer into specific locations if you need to. It's just around the front end on, where that patient come in from, if they're a health system patient, if they're a health plan patient. We have to know that information to be able to present options. It's not anything around steerage or presenting specific places to a patient, but it's around options that patient has. So us knowing where that patient came in from, is it a Blue Star Health System patient, or is it a Cigna patient? We have to know that information up front to be able to present those options to that patient.
Got it there. I guess we have a question from the audience that Brian asking. So what makes it, I guess, a PCP want to become part of the MDLIVE? Again, service provider, is it purely compensation? Is there some other incentive do you offer to attract them?
Yeah, I think it's for consumers and providers, it's around convenience. It's about, seeing patients in the comfort of your own home. Many providers these days are tired of the overhead. They're tired of the practice management component of running their offices, and they just want to take care of patients. So you wouldn't believe the number of doctors, in their mid-50s that have kind of been done with their own practice, that now want to sell their practice and come online with MDLIVE. And we have a lot of younger doctors who love technology, and it's just it's a wonderful concept to where you could see patients from the comfort of your own home. These patients are happy to see you. They love interacting with you because you're providing them convenience at a high quality, healthcare experience. So I could give the team the number, but we're always looking for great providers out there who want to be a part of a phenomenal, fast growing company that takes care of wonderful patients and members around the country.
That's super. I guess, Michael, then, so from the physician perspective, if they were to, let's say, become a virtual primary care provider in general, I guess, serving MDLIVE in there, is there enough work they could essentially build almost like a full practice in there? Like they could get paid enough? Would they really still need to have like some other gig almost in order to make get enough payment for the whole year?
Yeah, well, a lot of them, like I said, it depends on how much. If you want full-time work, MDLIVE has enough to make you a full-time provider. I can tell you that. But a lot of them still want to be able to practice, 3 days a week in their practice, and then they spend 2 days a week with us online. So we offer a variety of models to make sure we're meeting their needs as a provider. But Milton, if they want to come full-time to MDLIVE, we have a lot of business. So MDLIVE has over 42 million Americans that have access to MDLIVE either through their health plan or through their employer. That's not even counting all the health systems we have that run and leverage our technology for those patients. So a lot of opportunity there if they're interested.
Got it. Okay, so the audio member heard it. If you need the extra assignment, make sure you get hooked up with MDLIVE. They'll keep you pretty busy in there.
Yeah,
that's always great to hear in there. I
it
guess
is.
for example, another sounds a big momentum moving in the industry. Is like American Well making a lot of movement. I know, like if you had to take a bet between Teladoc and American Well, do you see like who
I see
will win?
MDLIVE as number one.
No, of course, MDLIVE number one, probably between number 2 and number 3.
Yeah, no, I see MDLIVE. I mean, we're doing a great job in the market. It's amazing what we're doing with virtual primary care. We're leading in innovation and consumerism. We focus on NPS, Milton, which we didn't really talk about, but your Googles, your Amazons, your Apples, your Microsoft, your Netflix, their NPSs are in the 60s to low 70s. Yeah. MDLIVE, our NPS right now is 81, 82 almost. I mean, when you talk about the consumer workflow and the frictionless experience, it's around MDLIVE. But to the other suppliers that you mentioned, this is a very competitive market, and that's why I love being a part of it because, again, innovation or competition fuels innovation, and I love competing out there. And I think everyone's doing a great job and doing it for the right reasons. And I love being in this industry of virtual care.
No, that's awesome. Definitely between the Teladoc, American, and MDLIVE, I'll place my bet on MDLIVE.
There you go. So would I.
I guess we have an audience member from Becky asking, so do you, I guess, also currently use nurses and medical assistants in terms part of your service?
So our network is, the answer is no right now. So we only have, like I said, 1,400 MDs, board certified MDs. We are working on a few pilots for nurse practitioners, but that hasn't been officially rolled out yet. So we are looking at that very, very closely to bring in NPs, but we have not done so to date. The majority of our health systems, though, when they leverage our technology, they have NPs and APCs on the platform seeing their own patients, but not in our MDLIVE provider network. Does that make sense?
God, that makes sense in there. Yeah. I guess we have so another question I have is, for example, right now there's a new player in the men's health virtual care space. It's called Vigor. In fact, they actually one of the sponsor for this webinar today.
Okay.
So they actually launched their platform. It's called hisvigor.com last month. It's actually gained a lot of like early success, a lot of traction. It seems they're growing pretty rigorously. I guess we're like companies like Vigor, Roman, Hims, now they're actually really deep dive on the men's health business, right? Around, and they have really this sort of attractive pricing, convenience in there. Now, for your virtual primary care model, do you feel like you could create a segment to be able to compete with some of these sort of men's health business, or do you feel like maybe that's not your
we could definitely create it to compete. Absolutely, we could. We've talked about it because, as you noticed, I mean, those organizations, they're all doing relatively well, focused on men's or women's health, really. Yeah. You got your Romans, your Hims, you got all of them out there. It's not something that we've decided yet to roll out, but it is in consideration. But no, we haven't done it to date. We want to focus on our core healthcare continuum and really rolling out virtual primary care. But I could see that being a portion of it maybe in the future. But for right now, Milton, those companies are doing good, and kudos to them. But we've thought about it many times, and we've voted, really not to focus there for the time being.
That makes sense. I think for the space you guys go after is so huge already. It's almost you don't need to go. I mean, one thing I like about, for example, the Vigor and similar services is the convenience. They actually deliver the drug to your home in there. Now, in terms of virtual primary care and also MDLIVE service, do you guys plan to add that as a sort of like a see doc, now the drug just show in my mail?
Yes, that's a part of the playbook and the roadmap for sometime in the future. Right now, we geolocate the patient. We pull up all their pharmacies around them, as well as pharmacies that work with their plans. So they get to pick which pharmacy they want the medication to automatically go to. But today, they do have to go to that pharmacy and pick it up. But yes, that's something that's on the horizon for us as well. Is how do you, again, it's all around the consumer experience and how to make that as frictionless as possible. So having the medications be delivered to the home is vitally important. It's something that we're looking at, that's on the roadmap.
Yeah, in fact, I will be when I look at this model, like the his Vigor, all this, I feel like almost that's like just a key part of the convenience. The drug just show up in your home, almost like I think we've been trained by the Amazons that you almost expect.
It would be nice.
Things to show up in the door.
Yes.
Yeah. Okay. Yeah. So hopefully you guys have that soon, and I think that would be like amazing addition to.
It would. We're really excited about the future.
Yeah. I guess, Michael, there's other these were similar a primary care things like 98 degrees and other things, purely text chat based. These are primary care service in there. How do you see, I guess, the MDLIVE service compete with those text chat centric service?
Yeah, I think so. I talked a little bit about our chatbot, Sophie. So Sophie today interacts with patients via text and chat. She sends urgent reminders and alerts to patients. She also runs the patient through an adaptive interview, Milton, to where the patient is going through a question and answer session with Sophie, and Sophie's smart enough and has the branch tree logic and the evidence-based content to route that patient appropriately. So she does kind of an intelligent triage. We also have asynchronous care built into MDLIVE. So not only can you interact over a video or over a phone or a chatbot, you can also do an asynchronous visit with MDLIVE to be able to type in what your symptoms are, what you're having, send that into a provider, and they get back to you within a few hours. So I definitely think that MDLIVE will continue to be innovative and at the forefront of those texting and kind of chatbot capabilities. And it's something that our consumers really love about MDLIVE. But I agree with you. Yes, there's some other companies out there that are doing a great job, and we'll continue to keep up with them.
Awesome. Very great. And then as we're wrapping up in the final, I guess, 4 minutes, maybe I could just ask you 3 quick questions to wrap up. I guess first question, I mean, you share a lot of really exciting things in there, very visionary, both practical and so on. Like if you wanted the audience to remember just like one thing from your today, like what should be that one thing that they should remember?
That everyone is fighting for, I mean, the whole healthcare continuum is fighting for the digital front door of the average consumer. So you have your health plans out there who are offering virtual care. You have your health systems that are offering virtual care. You have Amazon out there and Google that are getting into virtual care. Everyone wants to be the face of digital health for the average consumer.
Yeah.
Virtual primary care is coming. That's what I want everybody to know, that the fight for the consumer has started and it's here. But virtual primary care and standing up online practices is vitally important. So that's what I would say is one of the most important things. And if you're not planning on it right now, you know, get some work groups together in your organizations and start thinking what would it be and how could we scale primary care to do it virtually for our patients and for our members.
Awesome, Linda. Okay, the next question is, I mean, you've been in the industry for a long time. You're one of the thought leaders to shape the whole field. I guess now, what is this one thing that you believe about telehealth that other people don't believe yet?
Well, I talked a little bit about my presentation. I don't know if I'm the first person to believe it, but there is going to be a rise of the virtualist. Like I talked about the hospitalist movement in the 90s. There's going to be a rise of people coming out of med school and wanting to do nothing but virtual care. I mean, I go around the health systems all around the country. Some of them are tied into universities and med schools. They're starting medical, curriculums around the country, training providers, future providers, how to take care of patients by doing it virtually. So there's going to be an enormous rise of the virtualist. And that's something we've been saying for the last 6 to 12 months. And I believe that is forefront and it's at the, it's ready to take shape. So that's something that I don't know if I'm the first person to say it, but I strongly believe in.
That's pretty exciting. I think that definitely is very controversial. A lot of people probably will argue with you, but I do like that vision.
Yeah.
And then the final question is, right now we have, a lot of this, right? We're gearing out, coming to the election, that moment. Again, there's a lot of debates around in DC about different things about healthcare, all these things. I mean, I feel like if you have a magic wand, you could just like make one thing that just happen within healthcare. Like, what would be that one thing that you wanted to be changed?
Wow, one thing I would change in all of healthcare.
Yeah, like anything could be like literally just a magic wand. You just wave it, it just happens.
Two things maybe. One is like universal reimbursement for all telehealth, procedures and telehealth services from a state and a federal perspective. I think the reimbursement is moving in the right direction, but we could do so much good in the healthcare continuum in the healthcare industry if we had the types of reimbursement that you have for brick and mortar for virtual care. I think that would do a lot. And then two is, I believe in, I struggle when I used to work in rural areas and populations that didn't have, medical deserts. They didn't have access to healthcare. Somehow I want to make sure everyone in America at least has some type of access to healthcare. I think that's a big proponent. It doesn't matter what side of the fence you sit on. It hates breaking your heart when you see a 10-year-old, that can't get the care he or she needs regardless of political affiliation. So that's something I wish that we could fix immediately, is just making sure every American has some type of access to healthcare.
That makes a lot of sense in there. I guess as we wrap up, Anne, maybe you could pull up our sponsor slide so we could give our sponsors marketing.
Thank you, Milton. Thank you, Anne. Thank you to the sponsor. Greatly appreciate it.
Yeah, and audience member, please definitely go to hisfigure.com and so on. And then Michael, maybe the final thought is, what's your thought on like Medicare for all? That seems to me the biggest, the debate that's happening right now in healthcare.
Medicare what did you say? Medicare what?
Oh, Medicare for all.
Medicare-for-All. Oh, I don't know. I can't get into political debates. I'm not the politician. I promise you. Again, I just want access and healthcare at a cost-effective price to to everybody. And I think virtual care is definitely a way to do that, and a way to scale, and a way to bring down healthcare costs. So that's probably it for me on the political front.
Okay. Got it. Michael, thank you so much for sharing your wisdom, your thoughts with us. I'm really, really excited. Again, thank you so much.
Milton, thank you. And thanks for everybody for joining. Sorry for the technical glitches, but hope everyone has a great day, and thanks so much for your time.
Okay,
Bye-bye.
thank you.